Welcome to the podcast. The Aging Queen. Welcome to the podcast. Welcome. And welcome back to another wonderful episode of The Aging Queen. We have our Dr. Kristen on with us. How are you, Dr. Kristen?
Hi, I'm good.
Our very own in-house doc. How do you like that?
It makes me feel special.
I know you're special. Special and pretty too.
Aw,
Smart.
thanks.
All the good stuff. So, another reason why we wanted to, have you, not only just your wonderful chat in person, but um, it's good that you're a regular guest because statistically, and from what I've been researching, a lot of younger folks, people in general now, are getting their news from social media, podcasts, YouTube, more and more instead of the traditional, linear TV sources. So we want to make sure that anything that we say comes out of really good sources, and what's a better source than a doctor? Um, so there, I said that. Where it's a privilege to have you on the show again,
Oh,
and I wanted to chat today about STDs.
yeah.
I think it's an important issue. We haven't really touched on it. And I think with the rage on PrEP that we had an episode before, that's opening the door for a lot of STDs that also went dormant for a while, right?
Mhm.
Um, I was telling you the story off air that I got poked, and I didn't get poked in a good way. I got accidentally poked by a nail. So the doc and Dr. Kristen and I were talking about tetanus shots, how when you should renew your tetanus shot, and Dr. Kristen recommended to get one.
Mhm.
Take it
I
over.
did.
Take it
I
over.
recommended to get a tetanus shot.
Every.
Well, every 10 years is when
Mhm.
you usually get a tetanus vaccine. But if you have a puncture wound like you got, especially if it's from like a dirty object, and it doesn't have to just be metal, that's kind of a wives' tale. It can be, you can have cut yourself on wood, you can have cut yourself in anything that's kind of just dirty, then
Mhm.
then insert then you would warrant a renewal of your tetanus vaccine.
And this isn't just a dirty date you've had. This is like something that really pokes you in a
Yeah,
different way.
right. There's dirt, there's rust, there's like just
Splinters?
germs, splinters, yeah, any of that. Like if you poked yourself with like a stake, like a wooden stake. But
Yeah,
regular
nails are
splinters,
notorious.
a small splinter like from a deck, like a super small splinter, no. It has to be like an open, like a wound where you had like where you bled.
Right. Like a puncture
Yeah.
wound and blood comes out. Yeah.
I know. Who would have thought
Yeah.
sleeping is
That
so dangerous?
I know. I had a killer sleeping arrangement, and anyway, I don't want to go into it. But yeah, there was let's just say that there's little pieces of furniture or beds that have gone wild and gone rogue. So be careful out there because things can get you in your sleep. Um, so that brings me to the question of what other vaccines do people need to get, especially gay people, in order to stay healthy? There's so many out there now. Feel like there's a vaccine for HPV and there's vaccines for this and that. Do tell us a little bit of what we should get for ourselves.
So, in terms of vaccines for sexually transmitted diseases, there are really only two.
Mm-hmm.
One is the HPV vaccine that is approved up until the age of 26. Uh, any
In the U.S. or mainly, right?
um, that's a great question. Probably just in the US, because
Mm-hmm.
every country has a different authorization process. So in the US, it's approved up until the age of 26. Now, that doesn't mean that you can't get it past the age of 26. It just means that your insurance probably isn't going to cover it and that you'll have to just pay for it out of pocket. The reason it's only approved up until the age of 26 is simply because that is the age group in which they studied when they did when they did their research and said and deemed it safe. So I
Right.
am a perfect example. At the age of I got divorced at the age of 37 and was sexually active again with new partners, and I wanted to be protected against HPV because in women it causes cervical cancer, in men it can cause rectal cancer,
And throat
um,
cancer, right?
and throat cancer. Yeah, absolutely. And so I wanted to be protected against it, and so but I was over the age of 26, and so I just paid out of pocket. It was like $300 or something,
So
but I
is it
did it.
also because most people get STDs under 26? Is that the reasoning?
Yes, that is by far the most common age group for people to have sexually transmitted diseases.
Hmm.
Um, the other vaccine that prevents against an STD is the hepatitis vaccine, Hep A and Hep B. Specifically, Hep B is hepatitis B is a sexually transmitted disease. It
Mhm.
passes through semen, it passes through blood, um, it's considered a sexually transmitted disease. Most of us get the hepatitis A and hepatitis B vaccines as kids, though.
Right.
It's kind of a standard part of the vaccination schedule for pediatrics. Hep HPV, the HPV vaccine is newer, and
Mhm.
and it hasn't really been fully incorporated into the pediatric vaccine schedule. It's still kind of an option for people to get. So most people in this country are protected against hepatitis as a sexually
Mhm.
transmitted disease. But the HPV is kind of hit or miss if your parents wanted you to get it, or if you chose to get it as an adult.
Now I have a little fun story about this,
Ooh.
hepatitis vaccine.
Oh, of course you
Mm.
do.
Yeah. It seems to be that it's a unique American thing to give to when you're young, to young kids,
Mhm.
because, when I lived in Europe and I got my blood test, it came back positive for it, but it came back positive for it in a way that the doctors knew that it was because I got the vaccine in the US, because
Mhm.
I was American. Um, so they don't seem to do that in Spain or in other European countries. Um, is there is that true? Like if you do get vaccinated, it comes out positive for I guess antibodies, right? If I'm right.
Yeah. Yeah, if you, are you can be positive because you had the disease, or you
Mhm.
can be positive because you got vaccinated,
Right.
and the blood work differentiates which of those cases it would be. So we can tell you actually have hepatitis, like you currently have hepatitis,
Mhm.
or we can tell that you've had it in the past and cleared it, or we can tell if you were
You were
vaccinated
vaccinated.
from your
Yeah,
blood work.
yeah, because
Yeah.
that's what the doctor told me that, he could tell that I was vaccinated as a child, so, I don't
Mhm.
know, it was very eye-opening for me,
Yeah.
because he said that people in this was in Spain, the people in Spain don't get it, when they're young. Maybe it's changed now, but back in the '70s, that was the case. It wasn't a
Hmm.
routine thing.
That's so
Um,
interesting. Yeah, I don't know
yeah,
why.
yeah, it's interesting. I think, we do some other stuff here in the US. It's a little different. When you go into college, you have to a long list of boosters and other vaccines you have to. I remember going to my doctor and then the health department to get some of them. Um, but yeah, it's always good to as we get older to renew them and then incorporate new vaccines if they're helpful and useful for you, I think, as a layman person. And but you should always do your homework on it and talk to your doctor, see if it's right for you. Um,
Yeah. Well, I have to say that the HPV vaccine was kind of it was kind of groundbreaking in the sense that
mhm.
it's the first vaccine that we've ever had that protects you against cancer.
Oh, wow.
Like all the
Right.
other vaccines that we have protects you against disease, against
Mhm.
an illness. Um like infections, but nothing. But HPV is the first one to ever protect you against getting cancer. So that was a really
That's
big
great.
deal. Yeah.
So what are the new STDs out there, or the ones, let's go from the silly little ones that are kind of comical and you share with friends to the real serious life-changing ones, and what can we do to stop all of them?
Well, there are kind of 5 sort of big STDs, and in order of most common to least common. The most
Mhm.
common is chlamydia,
Mhm.
and then gonorrhea, and then syphilis, HIV, and hepatitis B. Those
And
are kind
syphilis
of
is
the big
raging,
5.
right?
Syphilis is yes, raging syphilis. Raging syphilis. Especially in the United States and in the EU. Like in the EU, actually, syphilis infections like are skyrocketing. But
In the
same thing
EU?
in the EU and in the US, both.
Oh, yeah. Mhm.
Um, but so chlamydia and gonorrhea are still the most common, um, and and those are just bacterial infections that you can
Mhm.
treat with an antibiotic. So those are pretty. Um, I mean, they can cause complications, but they're pretty easy to treat.
Right.
Syphilis is a little bit more complicated to treat, but it still is treated with antibiotics. It can be a longer course of antibiotics, but it's still an antibiotic treatment. HIV, we all know that's a virus with no real cure.
Mhm.
Now there are antiretroviral medicines that can essentially suppress the HIV in your body to such a good degree that you have zero virus
Mhm.
um, detected in your body, but there's no cure for it. And then same thing with hepatitis B. There's no real cure for it because it's a virus, just like HIV. And so there's drugs that can suppress it. Your body could actually clear it on its own
Mhm.
potentially, but there's no
Really? How common is that?
there's no cure. Hepatitis B, if you get it, then
Mhm.
in most cases your body will clear it, just like HPV,
Right.
which is the virus that causes um, cervical cancer in women and then rectal cancer or throat cancer in men.
What is
So
the difference between A, B, and C of hepatitis?
um, they're all called hepatitis because they all affect your liver.
Mhm.
Hepatitis means inflammation of the liver.
Okay.
A, B, and C are all different strains that are all contracted differently. So A is usually through the mouth, contracted through food. That's the
Mm.
most common way that you get hepatitis A. It's through dirty water. It's through oysters. It's through fecal matter in water.
Wait, whoa, 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 whoa. Oysters?
Yeah, raw oysters can give you
Stop.
hepatitis
I just
A.
had some the
It's
other day. I love raw oysters.
it's because
You just ruined
hepatitis
my day.
I know, I'm so sorry. Well, so this is a little anecdote. So, hepatitis A, you can get that from drinking basically from ingesting feces, like dirty water that has feces in
Jesus.
it or food that isn't properly washed, like um or like in foreign countries when they use feces as fertilizer and then they don't properly wash the fruits and vegetables. But you can
I
also get
guess
it
you
from
can also get it
oysters.
from Saturday night butt disease or something, like just
You can get it from licking like someone's like
butt.
yeah, like licking someone's rectum.
Which
Um,
I'm gonna tell you
Absolutely.
something, it's not as appealing as you get older. Now I get why, like, STDs really go up to 26 because,
Yeah,
like
I know. You're like,
don't touch me. Don't touch me at all, you know?
don't touch me. Um, so hepatitis A is short-lived, and the body usually clears it on its own, no problem, short-lived. Hepatitis B so hepatitis B is acquired through sex, not through
Mm,
eating dirty water or drinking dirty water. Hepatitis B is acquired through sex, and that one, for most people, they can clear that one in a short period of time, just like hepatitis A. But there is a percentage of people who cannot clear hepatitis B, and it
mm,
stays in your body and it becomes what's called chronic. and then it causes this chronic inflammation of your liver, which over time can cause liver failure.
Mm,
Hepatitis C is through blood. So it's oftentimes it's transmitted through IV drug users sharing needles
I get
or
it,
like
yeah.
needle sticks in like medical facilities but it's only through blood and there and that one has no short-lived phase that your body might clear on its own. This only has a chronic phase. So it's the most dangerous. It's the most deadly. Um, so that's and there's no vaccine against
That
hepatitis
was
C.
my gonna be my next question. There is no
Yeah,
vaccine for the C.
for the C, only for A and B. But B is the one that can be passed through sex. So that was, the one that we're sort of talking about today.
Okay, so you can't really get hepatitis C through sex.
No, no,
Okay.
it's very rare. It's through blood. So if you're
Right.
having very bloody sex, like if you're having like
Jeez.
penetrative, like rectal
Like Game of
sex.
Thrones sex? Like
Yeah. Well, like penetrative rectal sex. So the person who is receiving
right.
someone else's penis in their rectum, they are at they're at the highest risk for getting any bloodborne disease, which would include HIV and hepatitis C.
Alright, so, thank you for that rundown. I think it really opened my eyes. I always wondered what the differences were between A, B, and C, so it's really good to get that, clarification. So, here are some statistics on, I wish they were better, but homosexual men are more likely than heterosexual men to have gonorrhea with a rate of 30.31% compared to 19.83% of heterosexuals. Early
Hmm.
syphilis, homosexual men are also more likely to have early syphilis with a rate of 1.08 compared to 0.34. Anal warts, same thing, 2.9 compared to 0.26. HPV, um, may not show any symptoms, but also higher in homosexual men. So, gay and bisexual men are disproportionately affected also by HIV. In 2019, they accounted for 70% of the 34,800 estimated new HIV infections in the U.S. However, the CDC reports the usage of PrEP and PEP medications that can lower the risk of contracting HIV remains low among gay and bisexual men, especially Black or Hispanic men. So there's some hope for that.
Hmm.
Um, but yeah, guys, I think we need to wrap it up more and be careful out there. And goes for everyone, not just for all of us. Not that it doesn't matter what age you are,
Yeah.
because there are some of
Yeah.
these STDs that are coming back stronger than ever.
A lot of them are making, yeah, like syphilis is making kind of a resurgence. But there are a few reasons that gay men, or MSM, as I sometimes refer to them, which is MSM is, men who have sex with men. So that population is at higher risk for getting an STD because of the number of concurrent sexual partners. So sexual partners at the same time, sex without a condom, anal sex, like we talked about, that is more likely you're more likely to contract something because of micro tears.
Tearing.
And then recreational drug use. Recreational drug use in any population makes those people more susceptible to getting STDs because they make poorer choices. They don't use a condom because they're
Right.
drunk, or they have sex with multiple people in the night because they're really drunk. So those are the reasons that the MSM population is at a higher risk than the average population. I should have mentioned, and I forgot, that the HPV vaccine also prevents against genital warts, which is another reason
Oh,
to
that's
get it.
great.
Yeah, yeah.
Yeah,
There's so there's
that was my next.
yeah, yeah. When you mentioned warts, it jogged my memory that the HPV vaccine. There's many strains of HPV. Some cause cancer, and some cause warts, and the vaccine protects against
Mhm.
all of them.
Okay, so yeah, and what about herpes? What's going on with the herp nowadays?
So herpes is. It's also a virus, which, as we know by now, means that there's no cure. There's only
Yeah.
suppressive there's only
We all
suppressive
became,
therapy.
pseudo nurses during the pandemic.
Exactly, exactly. COVID was very good in terms of, like, patient education.
Yeah.
Everyone now knows that it takes, like, 10 to 14 days for a virus to run its course. But in terms of herpes, herpes is widespread. Probably about 60% of the population has herpes. Whether or not they know it or not is another story. But cold sores are the generic
Yeah.
general term for herpes. Not everybody knows that, and so some people say, "Oh, I don't have herpes, but yeah, I get cold sores every few months when I'm stressed out or when I get sick." But it's the same thing, and you can get herpes or like these like cold sores, these in your on your mouth or on your rectum, or
Mm,
in your like genitals. Inside your vagina, you can get them, you can get them outside. You can get them on your penis, you know, on the penis itself, on the pubis around the penis.
mhm,
So you can and it's spread through rubbing, basically, through contact. People, like, if you have a herpes on your lip and you just kiss somebody very hard and you have sustained contact from your lip to their lip, then the next day you could wake up with a herpes in that exact spot where their
but
herpes
a
touched you.
lot more some people are more susceptible to the oral than others, right? Because I've never gotten cold sores, but I remember, like, I won't say her name, no one will know her in school, but it's like, let's say her name was Sally, and
Hmm.
Sally always had cold sores, especially in the winter, for some reason, like, and some people would make fun of her. But why are some people more susceptible, or do we even know, than others? And does it mean that you don't carry the virus, or is just dormant?
It's just dormant. If you have the virus, so the way that it works is that you can contract herpes through sustained contact. So, like, for example, if I have herpes on my mouth and I'm giving somebody a blowjob and my lips have sustained contact with their penis, then I can pass my oral herpes to their penis, and now my oral
Yeah,
herpes
but
has become their genital herpes.
cold sores are the same thing, or no?
Same thing, exactly the same thing.
So,
Yeah.
for someone to have cold sores, it was a a a a sexual thing?
It's that no, no, that's a great question. So, herpes is just cold sores on the mouth. It often is passed through sex or just through
Okay.
kissing. Like, if do you
So you
consider
can get it if it's an open sore and you kiss, but how did that person get it if they didn't kiss?
you can get herpes from like from your mom, from your dad, from your
Oh,
parents. Like,
through
just if
birth.
they
Yeah.
Not really from birth. No, it's not from birth, but, like, if your mom has herpes or your dad has herpes and then they kiss you as a baby, they cuddle you and they kiss you, they can give it to you.
Mm,
You also
I
can get
see,
it
I see.
from sharing glasses, like
Oh.
in the Peace Corps in Peru, a lot of people get herpes because they all share cups. So
Um,
it's in the saliva,
that's how you can get strep too, right?
yeah, yeah. So through kissing from, like, a mother to the child or a father to the child, or like romantic kisses, you can get herpes. You can also get it from sharing glasses or forks with someone else who has it. Or you can get it from like, just like from kissing, from touching one body part to another body part. Like, some
Is
kids.
mono is mono
Mono is
considered an STD?
No, it's not. It's not
Even though it's a
considered an
kissing disease, right?
It's a kiss. Yeah, it's sort of like COVID, like, you just can get it.
Okay.
You can get any of those respiratory illnesses from contact with somebody, but it doesn't have to
Look,
be.
after this show, there's gonna be a lot of, people living in a little bubble. They're gonna get like the
Yeah,
bubble boy. Yeah,
yeah.
it's like, jeez. You can get it
Uh,
from cups, you can get it from kissing, you
you
can
can
get
get
it
it from
from your
anywhere.
mother.
I know, but the most common way that people get it in this country is through kissing.
Mhm.
or through oral sex, or like, or through
Right.
sex. Like, if
Right.
you have it on your, like, on your genitals, and you rub your genitals against someone else's genitals during sex, then you can pass it to them.
Right.
Now, once they contract it, this
Mhm.
kind of goes to your question about Sally. Once this other person is exposed to it, their body can clear the disease. Just like
Okay.
someone can clear HPV, just like someone can clear hepatitis, A or B. Like, y- for some people who knows why they have a robust immune system, who knows why in that moment their body can clear that virus, and they
Clear it
will
means
never,
kill it
like, get rid of it, like
forever. Forever.
eradicate it forever. Like, basically prevent it from entering their, like, block it off before it enters their body,
Oh, okay.
essentially. So some people can do that, and then and those people, you would, will never even know that they were exposed. Will have never no will never have a symptom, and can't transmit it to anybody else,
So
because they don't have it in their body.
this herpes virus is wild to me because it also gives you shingles, right? I mean, what is shingles? And is it considered an STD?
No, it's not herpes. It's the chicken pox that comes back as shingles.
Oh, but isn't
And
it a part of
that's,
the herpes family? Or
um technically, it's a part, it has the word, uh technically it's in the herpes family. Yeah, but it's not a but that's just like the nomenclature. It's
the
sh-
Xi something, Xi
yeah, zoster,
zoster, yeah.
but shingles is a possible sequela, or a possible side effect from having had chickenpox as a kid. So that's
Mm,
totally separate from herpes. It's not a sexually transmitted disease. If you get chickenpox, if you ever actually got chickenpox, not the vaccine for chickenpox like we have
yep,
nowadays, but you actually got chickenpox, then that virus lays dormant in your body, because, as we know, it's very hard for the body to clear a virus. So that that chickenpox lays dormant in
just
your
hangs out.
body, and it can come back, it can recur as shingles as you get older, and as your immune system depletes, because as we get older our immune system depletes.
Right.
And so that chickenpox can come back as shingles. There's a second there's a now there's a vaccine that you can take when you're like
Mhm.
60 or 65, um, to prevent against getting shingles. It's a shingles vaccine.
Yeah,
um,
I see these, advertised. Um, so what are the main lifespan of, let's say, a gay man? What kind of vaccines should they get to prevent, first thing, any cancers due to STDs or STIs? Okay, let's take a step back. What's the difference between an STD and STI?
Um, Good question. An STI and an STD. So, an STD is a sexually transmitted disease. An STI is a sexually transmitted infection.
Mhm.
They're essentially, they're saying kind of the same thing, but technically, what the difference is that um, you can have the disease inside of your body without having it cause an infection, like
Okay.
herpes. Herpes would be like, can lay dormant in your body. So that's an STD. You have the disease, but you don't.
Mhm.
But whenever you get the flare ups, whenever you get
Mhm.
the cold sores, then you're actually having an infection, and so that's the difference. But and gonorrhea and chlamydia, we haven't even talked about those. Those often have no symptoms. Like, they don't. They're in your body, but they're asymptomatic, and so you have the disease, but you don't have the necessarily have the infection.
Those are easily to get tested for. Some of them are urine, right? Urine test.
Yeah, yeah. So let's talk about chlamydia and gonorrhea, because those are important,
Yeah.
and they're often under tested. So
Gonorrhea seems to be raging also.
yeah, so chlamydia and gonorrhea in the gay population can affect three areas of the body. It can
Mhm.
affect the penis,
Mhm.
specifically the urethra, which is like the P tube inside the penis, but it can affect the penis. It can affect the throat, and it can affect the rectum. And so you can get an infection in all three of those places. Um, if you get an infection in the penis, you might have penile, like pussy discharge coming from your penis. You might have pain in your penis, pain in your testicles. It can spread to, like, it can spread to the prostate. So you might have like pain deep inside in the prostate. If you have, um, and that can, and then, if you have chlamydia or gonorrhea in your penis, and then you have anal sex with someone and you ejaculate in their rectum, then you can spread it to their rectum. So now they have chlamydia and gonorrhea of the rectum.
Yeah, wow.
And
And it's easily spread, right? Or is
yeah,
it hard?
it's very easily spread. Um, the and so if you want to get tested for chlamydia and gonorrhea, then you need to really have all three of those sites tested separately. Like, you need to give a urine sample for the penile chlamydia and gonorrhea. You need to do a throat swab to see if you have it in your throat, and you would need to do a rectal swab to see if you have it in your rectum. There are a lot of labs now that allow the patients to self swab, so that
Mhm.
it's less embarrassing. It's because you can just swab your own rectum, basically. The reason that it matters is that if you only do the urine test, which is what most people do because it's kind of the most classic form of chlamydia and gonorrhea, then you will most likely, um, uh, I found a statistic that says that approximately 70% of gonococcal and chlamydial infections can be missed if you only perform the urine test.
Wow.
So, yeah, and chlamydia of the throat and chlamydia of the rectum are also increasing in prevalence. The reasons that those matter is that if you have chlamydia of your throat and you give somebody a blowjob, you can pass it from your throat to their penis.
Now,
Um,
is your doctor the best one to conduct these, or should you go to an STD clinic?
Either way, equivalent. Yeah.
Because I think a lot of some doctors will just do that urine test or blood
Yes.
test and
Yes.
not actually touch your pecker,
You
you
have
know?
to, yep, you would need to ask for that. You would need to tell your doctor
Okay.
that
You
you
want the
are
full
MSM. Yeah.
service.
That you would need to tell them why, because if you don't have receptive anal sex, then there's no reason for you to test your rectum. So you would just
Mhm.
need to tell your doctor that you are, that you are MSM, and that you have engaged in receptive anal sex, and you want a rectal swab for chlamydia and gonorrhea.
Yeah, and I wanna another reason why we're talking about this is to get rid of any shame that lingers with
Hmm.
this. I think, uh, statistically and historically, gay people, queer people, anyone on the, in LGBTQ plus community, um, have a lot of shame going to get medical help, and that causes more issues and more pain down the line. So make sure you find good partners. There's a lot of also gay health centers in major cities that provide a lot of this testing and have free medical services also if you can't afford it. So there are resources out there. Don't be shamed of anything, and this is just a part of life. Everyone gets these things, or and if they don't, um, you wish they did. No, I'm just kidding. Um, the point is that there shouldn't be any shame, and just make sure you find good partners, not
Yeah.
sexual partners, but medical partners that make you feel good about yourself and not shameful, because
Yeah. I mean,
you want an ally. Yeah.
yeah, straight people get STDs too.
Oh, yeah,
Not
tons.
just MSM. I mean, they're at a slightly higher risk, but I mean,
Well,
everyone's at risk of getting an STD, and so doctors, I think doctors nowadays are um pretty open to treating to considering how common it is among the entire population, men and
yeah.
women. And especially, like, like when I went to medical school, um, in like 6 years ago, and my medical school, I mean, it was in Florida. in the United States, but it was like very, very open to talking
Right.
about MSM populations, by sexual, transgender. And so I think a lot of those old kind of stodgy, um, I think, the modern medical training is much more open minded.
That's
Um,
great because I remember as a kid, and this goes in honor of the late great Dr. Ruth, um,
mm,
who just passed away recently, and we
oh,
have
I didn't know.
to honor her that she was talking about sex, early on in her career and in public when it was still taboo. She was talking about gay sex also, and a lot of issues, STDs and health, sexual health. She was just a great person that elevated and opened things up. So it's a loss for us that she's
Yeah,
passed.
yeah, yeah.
But I
She was a
think
trailblazer.
she was a trailblazer, and the best way to get rid of any kind of shame and to is to just talk about it, put it out there,
Hmm.
have
Absolutely.
discussions and
Yeah,
information.
yeah, yeah. Definitely.
So let's go back to what does a person going through adulthood and aging, what's kind of like their big milestones with vaccines or with any kind of STD, checkups? Should they do this every 6 months, every 3 months, once a year in their usual kind of checkup? What should they do? Let's.
Yeah, so the hepatitis A and B vaccines, they probably got as a child. I'm sorry, the HPV vaccine should be before the age of 26, and the earlier the better, cuz you want to get the HPV vaccine ideally before you start even having sex so that you're
Hmm.
protected. And then in terms of those are the main vaccines, the timetable.
Hmm.
In terms of getting tested for STDs, once you are sexually active, the recommendation is once a year at the minimum.
Okay.
That's the recommendation at the least once a year. And the reason for that is that um, a lot of these STDs that we were just talking about are completely asymptomatic. So you can have like chlamydia and gonorrhea are asymptomatic in about 50% of cases,
Hmm.
especially in the throat and in the rectum, and can also be asymptomatic in the penis. So you don't even know that you have it.
Right.
Syphilis is often asymptomatic, or you didn't notice the symptoms, because in the primary or early stages of syphilis, the only symptom is a small painless little ulcer on the tip of your penis, and it's
Hmm.
painless, and so people don't notice it. So
You think it's a mole or something.
yeah, or you just think it's a cut, or you think it's weird but it goes away, and so you just stop thinking about it. And so because chlamydia, gonorrhea, and syphilis, and even HIV, can be asymptomatic. Um, that's why testing is so important, because you can't rely on having symptoms to know that you have to get tested. You should get tested every year, even if you are completely symptom free and feel great. Um, One of the rectal chlamydia and rectal gonorrhea can increase your chances of getting HIV, because they create this chronic inflammation in the rectum, especially if it goes untreated for a long period of time. And that chronic inflammation can make the skin a little bit more delicate and what's called friable. It can make the skin a little bit more breakable
Hmm.
because it's injured.
Friable.
It's injured skin. And
Right.
so when you have receptive anal sex and you have these like little tears, you're more likely to have bigger tears. You're
Right.
more likely to have so a larger exchanging of blood and semen. So having these STDs can put you at a higher risk for getting HIV, which is the really bad one,
Right.
because it's the one that can affect you the most. And so that's in part making sure that you don't have any other STDs helps even more prevent you from getting HIV.
So maybe PrEP is right for you. We have an episode on that. You can weigh the pros and cons. Okay, so check our channel for that episode. Condoms can protect against HIV and many STDs. Make sure you also get tested regularly for these STDs and HIV, including rectal and throat testing. And don't forget to talk openly with your partners about STD prevention. And please, 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 if you do get an STD, make sure you inform your last partner so we can stop the spread of these crazy diseases, right?
Correct. All correct.
So, and did we miss anything for now? I'm sure we'll talk about some of these in future episodes or in more detail. Um,
The only thing that we didn't really talk too much about is syphilis and
mhm.
how that presents.
Yeah,
Um,
let's do it.
Syphilis is a it's a it's essentially it's like a bacterial disease
A
that you can that
medieval one.
yeah, a medieval one that's been around for thousands of years that has stood the test of time. And it will stand the test of time in your body. So if you get syphilis, if you contract it through sex, then the very first thing that you will get is a like I said, a painless ulcer on your genitals, on your penis or your vagina.
What if it's in the backside?
You then get it there too. If you contract it, yep, it's wherever the virus enters your body.
But
So it can
you won't know
You won't
if
know,
it's
yeah. You
if
won't
it's
know,
in
you
the
won't see it. It's that's and that painless ulcer is often missed, and that's and so then you go from that primary or early stage, uh, to the next stage, the secondary stage. And the secondary syphilis will start about 1 to 2 months after that ulcer.
Mhm.
So if you didn't notice that you had the ulcer, 1 or 2 months later, you can get, uh, secondary syphilis, which
But there's blood
presents
tests to figure out if you have
yes,
syphilis, right? If you
yes, there's a
do
blood test.
okay,
Yep.
so you'll
It's just
find it in your yearly workup.
yes, exactly. Um, so the symptoms of secondary syphilis, the big one is a skin rash.
Okay.
And it's a full body. I've seen this before on one of my patients. Full body, head to toe, covers your face, covers your torso, covers your like your legs. It even covers the palms of your hands and the soles of your feet, and
Hmm.
it's like little red or brown circles that almost are the size of like confetti all over your body. Um, and
Wow, kinda
that's
gross.
hard to miss.
Yeah.
That one is hard to miss.
It's like,
um,
wow, okay.
so you can get a skin rash. That's the most common uh, symptom of secondary syphilis. You also can get warts uh, like genital warts. Um, you can also get a fever, and you can get sores around your penis, around your mouth, your vagina. So those are kind of the main things that you would look for in secondary syphilis. If
Oh,
that goes untreated, if that continues to go untreated, if you continue to not have noticed, then at that point the virus stays in your body for years and years and years and has no other real symptoms, but it is slowly attacking different parts, different organs in your body. Um, and that you don't know that it's doing damage because you don't feel that,
right, right.
but it continues to damage. And the big things are it damages the heart, specifically like the valves of the heart, and it can damage your brain, causing people to go like in the olden days like crazy.
Well, there's
Um,
a lot of these kings that had
yeah,
syphilis went
head,
crazy,
yep,
basically.
head neurosyphilis. Yeah, exactly. So
So it's
that's
treatable at
yep,
any stage.
yep. It's treatable. It's treatable at any stage. However, the damage is not reversed. Like let's say that you went 20
Oh, wow.
years without knowing that you had syphilis, and by this point it's affected your brain and it's affected your heart valves. Well, yeah, we can give you an antibiotic, it's penicillin, to get rid of the syphilis, bacteria, but at this point the damage to your heart valves has already been done, and that's not reversible. Damage to your brain has been done, that's not reversible.
So I have a question about this penicillin thing.
Mhm.
You see in movies, older folks used to get penicillin shots. They
Yep,
don't give those out anymore. Why?
they do. For
Oh, they do?
syphilis, the treatment is a penicillin shot.
Okay.
We call it a peanut butter shot because it's thick
Mhm.
and it hurts going in. It
Oh,
hurts. We give it a lot. I am a doctor in the military. We have a
yeah.
very sexually active population here, so we see
Oh, yeah.
syphilis quite a bit. Um,
I
yeah.
mean, the only time I ever got a penicillin shot was when I had this I get strep throat,
Yeah.
and,
Yep.
it's really hard to get rid of.
Yep.
But, recently when I had strep throat, they said they don't do that anymore. They have to go to a health department, to get those shots. I don't know.
I don't know. That might be, I mean, we'll still give a penicillin shot for people who have like really bad, really, really bad strep throat. And they have a
No.
hard time swallowing the oral
Yeah,
pill, you
right.
know. So
Does it
we'll still
work
do
better or
shots.
faster, the shot? Is that what's the reason?
Yeah, probably. It works faster because it's more readily, it absorbs into your body faster than a pill does. So yeah, it would start working faster
Okay.
by probably half the time. So probably you would start seeing relief with that probably in 3 hours as opposed to 6 hours with the pill.
Speaking of antibiotics, I think we've all seen this in movies. Some people have lived through it in the 70s, 80s. It was very famous of, like, people would go on to party, and they would take their antibiotics before going to party, um, to prevent any of these kind of bacterial infections.
Oh, I see what
Mm.
you mean.
Yeah,
Oh,
yeah.
huh.
So they would take whatever, I guess, their penicillin, pills. Um, is that something that actually works, or is this kind of just, people doing magical thinking?
Ah, that's so funny. Um, doing magical thinking. Um, it probably does help a little bit, prevents you from getting it.
Mhm.
I would say, yeah, if you took like a doxycycline is the treatment um for for chlamydia. So like if you but you have to take it for like 7 to 10 days, it's like a long course. But if you just took
Right.
one right before you got exposed, yeah, it probably would help reduce you actually contracting the disease.
Wow.
Um
Okay, so they were
yeah,
onto something, our
I mean,
elders.
yeah, it's not like it certainly isn't a recommended course of action because you're
Yeah.
going to develop antibiotic resistance to these
Yeah.
drugs by taking one here, one there. Um, because the way that antibiotic resistance works is that let's say that there's the chlamydia bacteria in your body, and you just take one pill of an antibiotic. What's going to happen is it's going to kill off the weakest of those bacteria,
Mhm.
so the strongest remain, and then they replicate in your body, and
Mm.
so now you have
You in
only the
trouble.
strong ones are replicating. So that's what happens when you take it only one pill of an antibiotic or an incomplete dose and an incomplete course, is that only the weakest ones get killed off, which means that
Jeez.
the strongest ones remain and then reproduce, and then that now your body only has really strong ones.
This is very
um
Game of Thrones.
yeah, it's like it's considered an arm we call it the arms race,
Yeah.
between antibiotics and bacteria. Like,
Hmm.
we develop a better antibiotic, they develop a better
They
defensive
adapt.
mechanism.
Well, they're
Um,
live beings, right? I mean, a lot of these organisms that we call alien that we find on the moon or out there in space, they're microorganisms, but they're alive.
yeah,
Right?
I mean, organism is alive, yeah.
Yeah.
And like a virus is technically dead. It's a kind of a confusing delineation, but a virus is technically dead, and bacteria is alive.
Is
The
alive.
virus
Yeah.
is the virus is technically considered dead because it can't reproduce without taking over our cells. It needs our cells machinery to make
Mechanism of it.
to reproduce itself. It can't reproduce itself like on its own, like bacteria can.
It's like a zombie
Yeah,
thing,
exactly.
almost.
That's why in all those zombies movies, it's always a virus. It's always a
Yep,
virus
that's
that causes the
right.
zombies. Yeah.
Jesus.
It's never a bacteria. If it's bacteria,
No.
besides, we just give you an antibiotic and then you're boom, you're done. You're
So
saved.
think about it, it's a war race with bacteria because they're thinking they're alive and they're adapting.
Yeah.
But the virus is just it's a zombie, it takes over, it's kinda parasitic,
Mhm.
and it just, can't do anything without you activating it with your body and your
Exactly. That's
organism,
exactly
so
right. That's exactly
well,
right.
this has been very insightful. I'm enlightened. Um, I think we learned from this episode, no shame, get tested regularly, open communication with your doctor, medical provider, and your sexual partners. And God bless Dr. Ruth. And
Amen.
yes. And well, that's it for this episode, Dr. Kristen. Thank you so much. You're as lovely as ever and informative
Thanks,
and
Lewis.
very pleasant to chat with.
Aw.
So hopefully we'll
Anytime.
have yeah, thank you. We'll have more episodes where you can discuss more things coming up.
Absolutely. Anytime. I would love to.
Thanks. Thank you. And this has been another episode of The Aging Queen. If you like this episode, please don't forget to like and subscribe. Goodbye. The information provided on this podcast are opinions and are for educational and entertainment purposes only and does not substitute professional medical advice. Consult a medical professional or healthcare provider to seek medical advice, diagnosis, or treatment.